Bilali, fertility nurse and co-founder, chief clinical officer of Dandy Fertility. Thank you for joining us. We are here today with Dr. Ravikumar of the Sher Fertility Institute. We're going to go through not just, what goes into IVF and egg freezing and the actual, medication piece of it, but the emotional side of fertility treatment. We talk a lot about the emotional side, but we wanted to go into the emotional piece of the medication part. I think that everything is so emotional in this space to begin with, and then the medications add another layer of stress and anxiety for patients. And we get really detailed about the timing and if it's not done exactly at the right time, patients start to stress out, and we kind of need to go more in depth on how these medications are working and what's actually happening in your body so that patients can understand that if it doesn't happen at the exact time or things aren't perfect, that they're not necessarily throwing off their whole cycle and affecting, the success of their cycle. So I'm going to let Dr. Ravi Kumar from the Sher Institute, Fertility Institute, introduce herself, give us a quick bio, and then we'll go from there.
Sure. Thank you so much, Leila. Thank you for having me here. It's such a pleasure. My name is Dr. Ravi Kumar. I'm a board certified OBGYN that initially specialized actually in the management of endometriosis and PCOS, whether it's medical or surgical. And in my years of doing so, the overlap with infertility was so significant that it was just a natural change of pace to go into training into fertility medicine. So now I'm here with Share Fertility, optimizing protocols and patient care for many women.
Thank you. We're happy to have you. Um, we'll start with, when a patient is just starting an egg freezing cycle or an IVF cycle. So for both IVF and egg freezing, the medication part for the egg retrieval is essentially the same. Can you kind of just paint a picture for us? What are we actually trying to do with these medications? What is different when we give these medications versus what your body is doing naturally?
Sure. So, like, our body's reproductive hormones are in this rhythmic communication between the brain and the ovaries. And what we're trying to do is we're trying to override it and take control of it to get the outcomes that we want. When you kind of miss medication dosages over several hours consistently, what happens is our body's natural rhythm will kind of sneak out and regain its control. So, we want to avoid doing that by kind of having a rhythmic medication pattern with these IVF meds.
And when you say a rhythmic pattern, we're talking a time frame, right? We're talking you
Exactly.
have like a 2 to 3 hour window. You can do it between 6 to 9 p.m. or 7 to 10 p.m. You get to set that little window for yourself. But we're not talking within 5 minutes or
No, no.
very tight because I think patients get really stressed out about that. And I know that at Dandy, we help patients with at-home injection services. Our nurses go and do it for them. And oftentimes they're nervous to have any flexibility in that timing. They're like, well, my doctor told me to do it at 9 o'clock tonight. And unless it's the trigger medication, we do tell them you have this window. So when you say a rhythmic pattern, it's more of a window versus
A
it
hundred
has to
percent.
be.
Yeah, so very rarely is it within the hour that you need to do anything typically, but I like to tell patients there's kind of three categories of medications that we're doing with all these IVF protocols that are basically the same. You have your stimulation medications, your suppressive medications, and your trigger. All of them have a little bit of different time frames, and I like to start with stimulation medications have the biggest time frame, but it also matters where in the cycle you are. So your stimulation medications like Gonal-f and Follistim that mimic the follicle stimulating hormone of the brain, and Menopur that mimics the luteinizing hormone of the brain, these actually have a solid window. Like even if you missed them 3 to 6 hours, you're probably not going to ruin your cycle at all. Now, if you're talking about a 12 to 24-hour window, this might matter a little bit, especially depending on where in the cycle you are. So, for example, if you're like right up front in your cycle, you might kind of miss recruiting all the follicles you can get involved in that cycle. If you're in the middle of your cycle and you miss a 12 to 24-hour window, this is a way bigger window than what patients typically think. You might kind of lose some of the momentum of the small and middle follicles that are growing along, and they might become atretic, for example. But if you're further along the protocol, you'll be surprised. These follicles that are actually large have enough momentum to keep themselves going. So even if you missed a 24-hour dose towards the end of your protocol, they're probably already on their way to self-sustaining. So these are the most leverage or space providing hormones that are there, but it's important to understand what we're doing, why, and different critical parts of the protocol. When you talk about suppressing medications like cetrotide and ganirelix, this is a little bit different. Once again, you can miss it by maybe 1 or 2 hours, but if you get to like 3 or more hours, you might start having that LH creeping up, progesterone increasing, and you really want to avoid premature ovulation. So you got to be a little bit more tighter on that. We still give you a good 3 hour window for that as well. And then finally, the trigger medication. Now, this is the most critical, and you kind of touched base on that. Once you start the trigger shot, you're kind of setting a timer for the last maturation of the egg before it ovulates and releases. So you're in this narrow 34 to 36 hour window. We put it in 35 hours typically to give you a little bit of leeway. And this is very time sensitive because if you do it too early, you're going to end up with immature eggs. And if you do it too late, you're going to ovulate and you might kind of miss a lot of the eggs you want in that cycle. So different levels of severity and importance, but there's still, if you notice, you're not going to mess it up minute to minute.
Right, exactly. And I think, again, that's why we tell patients typically we say 2 to 3 hour window. You get a 2 to 3 hour window for all of your medications. We don't recommend going outside that. You get to set that for yourself, but
Yes.
don't panic if you gave it at 6 p.m. tonight and then tomorrow night you're doing it at 7 p.m.
100%. So you're still maintaining a fairly decent rhythm, unless you're missing whole days or several hours off. You're apart from the trigger aside, you're still maintaining that good rhythm, and it's actually fairly hard to mess up a cycle.
Right, right. We try to tell patients that too. And aside from the trigger medication, just because it directly correlates with the timing of your retrieval, the trigger medication, we do try to kind of overemphasize it is time sensitive. Your trigger has to be done, at exactly, let's say the clinic says that at exactly 11 p.m. tonight, we tell patients make sure everything is prepped and mixed and ready to inject at exactly 11 p.m. so that those aren't then the patients that are like, oh, it's 11 p.m. It's fine. I'll do it at like 11:30. I'll do it
Yeah.
at 12, that kind of thing.
Yeah, and I mean, like even me just describing the different medications and the different phases, I do not expect patients to remember which one's time sensitive and which one isn't. So it is totally good to have a calendar and have a rhythm. So you kind of, it's second nature. So you take the second guessing out of it of, hey, this medication has a little more leeway than this and whatnot. So give yourself a little bit of time grace slots and just have a pattern with the calendar is really the goal. So what you guys are saying is right on the nail.
Perfect. That's all for the egg retrieval portion. And then if you're doing an embryo transfer, the timing of the progesterone is super important when we're trying, if you're doing a medicated cycle and you're not going by we call it a synthetic cycle where we're kind of hijacking your cycle and doing it based on when we introduce the progesterone. Unless you're doing that, and we are giving progesterone for those type of cycles, when we talk about the timing for the progesterone and the transfer window, there's two different things when it comes to the timing. So again, we always tell patients the time of the actual administration. So if was told to start my progesterone tonight, and it's a day five, my transfer is 5 days later, I can do it again, a 2 to 3 hour window every night starting tonight. And then there's the timing of what day exactly are you introducing the progesterone and why. So can you tell us why the timing of when we actually start the progesterone for that transfer window?
Yeah, 100%. So when you take your first progesterone shot, you're starting this internal timer because during the estrogen phase, you're just growing the lining, getting it thicker, and it's proliferative. Once you hit that progesterone, you stop the proliferative stage and you're now entering where glands form, improving the stickiness, the nutrition that's provided to the embryo. And we're mimicking what nature does on its own. And actually, the changes that happen day to day coincide with the embryo. So, for example, a day 3 embryo gets 3 days of progesterone, a day 4 gets 4, and vice versa. Day 5 embryos get 5. So the changes in that lining actually coincide with the receptivity that it has to the embryo. So it is important to be timely with that. So if you miss it and you're like 12 hours late on one, you might change the pattern of how it's glandularizing over the time. And that could be the worst thing that could happen is it doesn't implant. And we're really trying to avoid that. So you want to get that nice, sticky, nutritious, welcoming, not defensive window for the embryo transfer. And that's why we do mostly day 5 transfers, 5 days of progesterone.
Correct. Yeah. And so, again, we tell patients, okay, today is Thursday, for example, we're doing the transfer. Your transfer is going to be on So Thursday, Friday, Saturday, Sunday, Monday. So your transfer is going to be on Tuesday. So you need that 5 days prior to the day of the transfer. So again, the day that we're introducing it is super important. I tell you
Yes.
to start tonight. As long as you do it again within a 3 hour window, that's totally fine.
Yeah.
The other thing that trips patients up is if they're traveling, and so there's a time difference, or if they miss the progesterone shot or end up doing it earlier or later, that kind of thing. We try to stress to patients that yes, again, this window, and we want to have some sort of window so we have that rhythmic pattern. At a certain point, it does start to build up in your system. So if you have already done, 5, 6, 7 days of it, and then you were a little bit off on that eighth day, that doesn't completely disrupt the whole cycle,
Yeah.
right?
I would like to agree with you, but I see how hard patients go to get these embryos. So I do like it to be on point. You are correct. You're not wrong. But, if you missed a whole day, then we
Right, not
technically do
missing
not
a whole
know. Yeah,
day.
yeah,
Oh,
exactly.
yes,
Not
yes,
missing a whole
yes.
day. Few hours off, totally okay. I think, planning ahead of time, like you said, anticipating the time difference, anticipating
Mhm.
transport, life does happen in a few hours, even 6 hours, 8 hours. You're probably okay. You are right. You have the progesterone steady state in your system. So it is a little harder than you think to ruin it, but I know how we all know how hard people work to get these embryos. So you do want to make the most optimal environment for them. But time windows are way better than 9 a.m. or
Missing a whole day. Yes,
exactly,
of
exactly.
course. Yeah.
100%.
We have patients sometimes if they're doing the oral and vaginal progesterone supplementation versus the injections, and they'll call and they'll say, I don't remember if I took my oral or if, do I take one less? Do I take one more? And we always tell them it can't really hurt to take one more. So if you can't
Yeah.
remember, take one more. But of course, we don't want patients missing a whole day of the
Right.
progesterone.
And if you do natural cycles where you ovulate and then like support with medication, you do have natural progesterone. There you have even more bit of room to wiggle.
Mhm.
So you're kind of combining natural and just supporting. So fully medicated protocols have some sort of a rhythm, and you do have built up steady state maintenance. Anything that's triggered with support, you have even more support naturally. So a little bit more leeway there as well.
And what would you suggest? So let's talk about both scenarios. So with the stimulation medications for the egg retrieval, if something does go wrong, if they miss a dose, or if they do it late, again, I know we're not as worried about doing it a little bit later or earlier versus completely missing a dose. But let's say, we have patients that call and say, I broke the vial of Lupron, for example, if Lupron is part of their protocol. I broke the vial of Lupron. I don't have any Lupron tonight. Or I have my Gonal, but I don't have my Menopur for tonight, and I'm supposed to start tonight. What do I do? How do you kind of course correct the egg retrieval medications, the stimulation meds?
Completely depends once again on the type of medication. Is the Lupron for prepping or is the Lupron suppressive? That's a very important thing to add. If it's prepping and you miss a Lupron dose, you could just restart it again tomorrow. And we always reassess patients if they miss a dose. For example, you missed your stimulation medication on day 3. I'd be like, you know what, it's okay, come on in. Let's do a scan. Let's check your hormones. If you maintain your rhythm, we can continue. Now, if some of the follicles are falling back, your estrogen plummeted, we're going to revisit what the outcomes of this protocol or retrieval is going to be. So the answer is you always reassess, you reanalyze, and you figure it out. Now, if Lupron is suppressing
But
you
you
and
don't panic.
you never panic. I think the first thing you do is you reach out to your support team, period. Never panic. Know that there is a solution and we'll figure it out together and we'll reassess and then we'll change your calendar accordingly. So the answer is you didn't mess it up. Don't freak out. Call, let's reassess and let's figure it out. Because I can't tell you how many times people forget. It's a little bit intimidating, it's a little overwhelming. And people have forgotten all stages of medication. Even if you missed your antagonist, you come in, sometimes the follicles don't pop. Guess what? You double up a dose maybe if you need to, if the LH is surging, or you just restart the single dose if you've been steady. You just reassess and you reevaluate, and there's probably a treatment plan for it to fix it.
Right, exactly. So I think, like you said, there's some medications that are more forgiving than others. So
Mhm.
if I don't start my progesterone today, then I'm not going to have my transfer on Tuesday. But
Correct.
if I missed a Menopur tonight or my Gonal-F tonight, I can call the office and go in earlier for monitoring and see how we kind of course correct.
Exactly. I think I've had someone take accidentally like 900 instead of 300. And you're like, oh my God, let's see
You
what your
have that.
hormones are doing.
Yeah.
Let's keep a closer eye on you. Not a problem. And guess
Yeah.
what? 9 out of 10 times, it's perfectly fine and it's okay.
Exactly. Yeah, we get that all the time.
Yeah.
And this actually kind of leads us into the next thing, the case for support. Why should patients use support services like Dandy, like having a professional fertility nurse come do your medications for you, review your instructions, make sure you're getting the right doses? Because it is very easy for lay people to give themselves more or less of a medication. So you have that Gonalef, even though it's a Ready-Ject pen, and you're just supposed to dial up the dose. Some patients don't know that. Some patients dial up the whole thing, or they'll do the
Yeah.
300 and they're like, wait, there's still liquid left in there. So I'm going to dial it up again and do it again. And so this kind of leads us into why, and this is why we built Dandy. So, I started doing this concierge business on a smaller scale so many years ago when I was working in clinic and getting a lot of these types of panic calls. And so why is it important that someone come and help you if you really feel like you're having a hard time understanding the instructions or if it's giving you a lot of anxiety?
Yeah. I mean, I think to even set the stage of what a patient's going through, like this is very emotionally, financially, physically taxing just to start off with. So even a simple instruction can seem a little daunting. And we're giving you three different medications with three different vials. We're not nurses by nature. So it's like you're learning how to do all of this right from scratch. And we give you one tutorial. One tutorial is not enough. I think the attention span stops after the first 30 seconds. I'm not sure. But having that support, being like reinforcing correct measurements, timing, administration techniques. I think that's really, really important. And it adds a level of security, safety, decreases their anxiety, improves their outcome, and really makes something that's otherwise intimidating enjoyable. Like you're enjoying the process of securing your future fertility, creating, future embryos. I think it's you can't put a value on it. I think it's immense.
Yeah, exactly. And then again, this is why we created Dandy. This is why we're trying to kind of bridge that gap between the physicians and the actual at-home piece of it. And we're trying to complement your medical care with actual medical professionals, actual fertility trained nurses. Um,
Yeah.
this has been super helpful. Is there anything else that you'd like to, tell the audience, someone who's about to maybe start their first ever cycle?
Yeah, no, I think that it seems a lot scarier than it is. And with the right support team, I feel like most people end up being like, wow, that wasn't a big deal at all. And while, some people may be intimidated to reach out to their doctors directly, teams like Dandy come in handy because you're always available. You can even make that a slogan. But you guys are always available to bridge that gap and just make the experience a lot better. And I really love what you guys do. So.
Well, thank you so much. Thank you for being with us, and thank you to everyone who is here. And we'll turn it over to I don't even know what I'm supposed to say at the end.
Yeah,
I know.
Matthew. Well, thank you for having me, guys.